Hi everyone, this is Grace with #MakeBullheadBetter, and I'm here again at Rivyve Behavioral, which I'm very excited to introduce a couple new people that have come on board here. So let's get started and see what is happening and when they're going to be opening and just what's going on. Alright, we'll start with you. Can you please introduce yourself?
Hi everyone, I'm Chris Luchiano, Chief Operating Officer at Rivyve.
Awesome. Can you introduce your newest hire?
Sure, love to. Next to me I have Kevin Jensen. He is Director of, he's got multiple roles.
Culture and training.
Cultural and training, but he's going to be handling some of our admissions and helping out with administrative as well. And over here we have Tom Boffman. He is our clinical director. He came on board maybe 3-4 weeks ago?
Yeah,
4 weeks ago?
About 4 weeks ago.
Okay, wonderful. So let's get started and talk about how Rivyve is going to come in and impact our community, as well as what you have done here as remodeling has been taking place.
Yeah, we've been doing last couple months, we've really made a lot of progress over in the building here. So we would love to show you guys everything. First off, up front here, this is all of our administrative and admissions and executive areas. The office is up front here. More so we want to focus on, the main residential area and what we provide for the residents of the community. So as we walk in here, you can kind of see, for those who have seen it before, this is our common area. This is where all of our behavioral health techs and frontline staff will be situated here. We've got multiple pods here where the males and females will be separated and doing individual, but also 2 separate programming for male and female. Down the hall here, we've got a couple areas here. This here is this is going to be our nutritional room. We'll be doing education and training for people, life skills, learning how to cook, when they get out of here, so they can cook meals economically, and we'll have people here doing some training for that as well. Let's go over here real quick. This was kind of my area, which I was saddled with, which I took on, was the gym here. The physical aspect of the program is something really big that we focus on because it's a mind, body, spirit. So we want to make sure that people don't forget about the body too as well. So we built this. We're still a few more things we got to add. We've had some challenges getting some of the equipment in here just due to COVID, but we're almost set, and we'll have this ready for the residents as well. Yeah, we're going to show you a room down here. We have the finished product down here. So what we're going to do next here, we want to, the biggest part is we want to show a room where the residents will be. The size of it, the amenities, and just an overall feel of what it's going to be like for the individuals. So we have and this will be a representation of what all the rooms are going to be like here. So to the right here, this is this is what all the rooms are going to be like. You can see they're really, really large in size. We've got all the amenities, their beds, really nice hybrid, comfortable beds, dressers, done some artwork in here. They all have their individual stuff. And the great thing about this facility too, which we're really happy about, is each one has their own separate bath. So if we go in here, you can see they have a separate toilet and shower, which is something you don't see a lot of. In the facility, 8 people or so will be sharing bathrooms, so that's a nice feature. Here's the closet space. Have their own areas here for their clothes. They've got their towels, hangers, everything they need, and they also have their own sink here as well. So this is a general, idea. Very large space, social distancing too. Again, we got to take into consideration the COVID and what's going on with that, but very well spaced out. Kevin, you want to?
Sure.
I'm gonna let Kevin talk here too. I always tend to take over, so I'm gonna let him talk a little bit about. He could talk about the common areas and then also in the dining area as well.
Absolutely. So a couple of things in regard to what Chris is saying as part of our theme. You notice we like to look up, and what Chris and I have both run treatment centers in the past, been executives, and one of the things we've discovered is when we take really good care of both our staff and the facilities, our residents feel a vote of confidence, and they feel like, you know what, these guys are treating us with respect. They're going out of their way to make me feel comfortable, which people need in early recovery, because it's very easy to focus on the wrong things. Oh, my bed's not comfortable, the food's not good. So we eliminate as much of that as possible. That way their focus can be where it deserves to be, which is on their recovery. They're doing hard work, they're in groups, they're looking at their underlying issues, they're looking at the addictions, the things that they're really here for, and we want to make that process as easy as possible for them, because it is a hard process. One of the things that we're very much focused on, that's why I take the title Director of Culture, is making sure the theme and the feel of our center is very welcoming. So you'll notice it's comfortable, but it's also fun. So the rooms, you've seen some of the names on things like the gym, the Roadrunner. The nutritional room is the Shake and Bake room. One of our core values is laughter. A lot of times when people are coming out of addiction, they've forgotten how to enjoy their life. They've forgotten how to have appropriate laughter. So we expect our staff to model that for them. So it is one of our core values is laughter. And we have a lot of fun. Soon we'll have a ping pong table in here for the men's side and one in there for the women's side, because we will have gender separate living as well as programming, so that people can, again, keep their focus where it needs to be. We have over here, we have some of the couches set up. We do like to do appropriate movies. You know, you can get a lot of education through these things, help people to hear other stories through video, as well as sometimes they need to relax after a lot of focused on improving themselves and understanding where they're at. If you look beyond there, you see the Da Vinci sign. That's actually the art room. So we've had a lot of success with the past in bringing in creative art therapy, where a lot of residents who can't always get comfortable opening up or expressing themselves in groups, all of a sudden you put them in art, they're making a mask, and really they come alive. They're able to express themselves in ways they couldn't before. So that's why we have the Da Vinci room. We'll have a number of tables in there. It's not quite set up yet, but we'll have multiple groups that happen throughout the week, facilitated, a specialist in art and also our counselors, and they'll be able to process what comes up for people in a different dimension. Right behind you is actually the Namaste room. So this is for people, spiritual connection, right where they're at. Some people higher power, other people just want to meditate. We're also going to have yoga and meditation groups throughout our programming. Now, right now it's full of chairs.
Excuse all the chairs right now. Yeah, we're still kind of planning and moving everything around right now.
Yeah. So we will have the AA components for those who resonate with that, because that is a huge benefit of recovery, is tapping into that system. But for those who aren't partial to that we're also going to support their process and give them different tools that they can use. You want to go into the barbershop, Chris?
Yeah, so this is our barbershop. This is something that kind of came in later on. We were excited about, because we talked about, like, what could we do with the space? It was a barbershop, and you know what, doesn't everyone feel so good after they get their hair done? So if we can provide just that little thing for these individuals, it makes them feel better, and they start, that's huge for us. So this is just a little amenity. It was a little feature we wanted to do. We'll get a licensed barber or cosmetologist or somebody to come in, and we'll do that service as well.
We'd love any volunteers in the community as well. A lot of times in our past centers, we've had everybody from dentists to people that cut hair, everybody that want to give back and help people when they're in this vulnerable position. So we're definitely open for anyone that would like to help the community in that way as we try to serve those in need.
So one thing, as Kevin was mentioning, we're going to have the art therapy room, and also yoga services. So these are things we'll contract out. So for people, we do have some people lined up that will be providing these services as well. Mindfulness, meditation, yoga, the creative arts, which you had mentioned. It's just a way for people to express themselves. If they can't do it in a group or they're uncomfortable with it, they can do it through the art as well. So we do have people coming in for that. And you want to talk about this, sir?
Yeah, a lot of living centers around what you eat, right? And so we put a lot of effort into making our cafe Rivyve, or our kitchen area, dining area, very comfortable. We've hired a private chef, and we're getting staff. We have a nutritionist. We can have Grace coming on board to help us teach and educate those who are open to learning a little more on how nutrition actually affects the mind, body, and spirit. And so we give a lot of opportunities, as well as providing comfort so that meals are taken care of, people feel good, so again, they can keep their focus where they need to be. So yeah,
as you pan around, you can kind of see we've created like multiple areas in here. We've got this area where all of the residents will eat, and after they're done eating, they can come over, sit down, relax a little bit, watch TV. This is a common area for the men's and women's, so they'll be on different shifts. Like from a lunch, one will be maybe from 11:30 to 12:15, one might be from 12:15 to 1. We're still working out the scheduling process, but after they're done, they can come sit down, relax a little bit. We've got this areas over here with the tables. They can read a book, do a puzzle, whatever really they want to do, just to kind of, settle in and just be comfortable with it.
Not like it over here.
Oh, okay.
Okay.
So as we walked right past some of our group rooms, we've named them again based on positive recovery type names. So we have courage, we have confidence, we have resilience. These are all words of increase that as our residents are going through treatment, we're encouraging them to look at the words they use, and we want them to engage in this type of recovery vocabulary as well. We also will be modeling that as our staff. Being positive. Nobody's perfect, but we'll be constantly training on how can we model these behaviors, how can we help people delete and question the tapes that play in their head that keep them stuck. And so we'll have a lot of evidence-based treatment. It's obviously what our curriculum is primarily going to be based on, as well as just holistic type of modalities that we can bring in to help everyone connect where they're at.
Let's talk a little bit about opening and how's that going?
Sure,
and
yeah.
hiring. I know you guys still have a couple
Yeah.
positions available. We just want to let the public know.
Yeah, so for anyone watching, there still are a few positions that are available. We're still looking at frontline behavioral health techs, behavioral health paraprofessionals, some laundry, maybe some dietary aides. Excuse me. So we do have some positions. We welcome, please send us your resume. If you go to our website, www.rivyve.com, and it's RIVYVE. I always have to tell them because it's spelled a little differently. Right on there, there's a link on there. I think it's under the About. You drop down, there's a job application. You can fill it out, and it'll come directly to us. If you have any challenges, phone number's on there. It's 928-296-8898. So they can call, fill out the application, send it in, whatever, we welcome it. Or if anyone has any questions, if somebody has a loved one that they want to, talk to us about, we are all capable of doing it.
Let's talk a little bit about that for people that haven't watched this before. What are you actually doing? What is this place for?
It's Behavioral Health Residential Facility. So we're going to be treating substance abuse and the mental health. So what that means is, somebody comes in with a primary, it could be substance abuse, and there's some co-occurring disorders or underlying issues. It could be anxiety, depression, whatever. Again, within the right level of care. If it's a higher level of care, we can send it out. We can refer it out. We're all about community, relationships and working with other members in the community. So that's primarily what we're going to be doing. But also too, so we're looking at, we're hoping 30 to 45 days for the residential piece, and we do have outpatient, which will be opening up very quickly. Detox will be a little later on down the road here. So again, if anyone has any questions, please call us. We do have people calling on our main lines. I know some people have wanted to refer to us, and I wish we were open. But we can refer you to somebody else right now if that's the case. But we're happy to take the calls, whoever has any questions for us right now.
So what's your projected opening date?
So right now, again, there's a lot of variables in play, but we're really hoping, we're going to finish the building up probably in the next week. We'll go into a survey window with the state. And then after that, we're at whenever the state's ready to come out and do the on-site visit and survey. So as soon as that happens, we can open the doors. We've got staff ready to do it. Tom is building the curriculum, the program. So it's really a matter of state and when that all happens for us. We are doing a grand opening. I don't know if we can talk about that. We're looking probably around October 9th. We were shooting for the 2nd. It may be the 9th. We're not 100% sure. We got some other things to do here as far as landscaping and finishing up. So we'd love everyone in the community to come out, take a look at the facility, ask any questions. We will have our counselors here answering questions or anything from the building, administration, whatever it is. We'll all be present to answer questions for everyone.
That's awesome.
Yeah.
Is there anything else you guys would like to add?
I just think this is a great community. We're excited. Everybody that we've talked to has been very supportive. We're going to have a wonderful recovery team with a medical director. You know, we already have a nurse practitioner hired, a huge team of counselors, therapists, different people that run the groups and facilitate the groups. This is going to be a wonderful thing for those in need, those who are struggling with addiction and unable to get out of that darkness. And this will be a light for them.
Awesome. I know that that's definitely a need in our community.
Yeah, it's been being here for about 6 months now. Kevin's been here for a little while. It's like we see the need here, and we want to get these doors open up to start serving this community. It's present, it's here, you know, and that's what we're here to do. And again, work with the community, whoever it may be, partnering with people. Yeah, we're here for the Bullhead, Mojave County, and just providing this resource that's been long overdue.
Absolutely.
Oh, one other position too. We will have a safety officer who will work from 8 at night till 5 in the morning, just to continue to keep the area secure, make sure everything's functioning as it should. We haven't had problems with that ever in the past at our centers, but just to make sure the city we're in compliance with everything. So if somebody has an interest in that, we have both weekdays and weekend shifts. You wouldn't be expected to engage if anything did come up, other than maybe a javelina. Just kidding. But
we don't have those here.
Yeah.
Really? Maybe a burro.
Yeah, a burro. That'd be more likely.
Yeah.
Yeah, so one of the things too, and is just to piggyback off of that, for those who have questions in the community, like safety and all those features, we have put in over 40 cameras in this building, inside, outside, taking safety measures. We take the approach, we want to put more staff in than necessary, because it's about safety of the residents, our staff, and the community. So that's one of the things that has come up, and we just want to make sure that we address that with people to let them know, like, hey, this is a safe environment, not only for the residents and the staff here, but also to the community as well.
Perfect. Thank you guys so much. I really
Thank you,
appreciate
Grace.
your time.
Yeah,
Thank you.
thank you.
Bye.
Bye-bye.